I am Dr. Teresa Owens-Tyson. I am CEO and President of the Health Wagon, and I'm also a family nurse practitioner.
I'm Jeff Johnson. I'm Professor and Chair of Pediatric Dentistry at Virginia Commonwealth University School of Dentistry.
This is actually our second annual Give Kids a Smile event, and what we discovered in the course of opening our adult dental clinic, that also we were doing some limited pediatric cases as well, is that the children of the area, what we thought they had Virginia Medicaid, and Virginia had expanded Medicaid, but however there wasn't a lot of Medicaid dentists accepting Medicaid in our region, and so we felt it very necessary to have this clinic so that we could get a lot of those children in. And what we were seeing, even on a day-to-day basis, we even seen a 12-year-old that is already needing dentures, and so we knew that this was probably just the tip of the iceberg.
Well, what we find, our kids just don't have access to care. They need people to take care of them, and there's not a lot of people that do that. So when we have an event like this where we can bring residents from VCU, dental students from VCU, people helping from the community, and people supporting from the community, all to take care of kids, that's exciting.
And so, we reached out to our partners to make this happen. And so we're having a great day, absolutely great day. We'll see anywhere from 85 to 100 children over this day and a half of dental care. And the smiles of these children, it just made me so happy.
Yeah.
I'm almost get emotional, even thinking about the children receiving care.
We know, for instance, that kids miss millions of school hours a year because of unmet dental needs. So when we can do something about that, we know we're helping them in the long run.
And we've tried to make this event very special for the children as well. And we have Ashton's bunny room with a bunny box in it. And so a lot of people in the area, they know my daughter. She had a brain tumor when she was 7, and so she had to have a resection of that tumor in the brain. And so I remember going in to the bunny room at LeBronner's Children's Hospital in Memphis, and what they did is they had a room to kind of alleviate the fear and anxiety that these children had, going through surgery. And so as they passed into the surgical suite, there was actually a bunny room, and so the toys lined the walls, and so they could pick out a toy. And they knew that when they woke up that they would have that toy waiting on them. So we wanted to do a similar thing here. So we've got the bunny box, we've got a bunny room set up with all kinds of fun activities for the children, and snacks, and coloring sheets, and a box full of toys, and and teaching the children how important their oral care is.
So we want to look past the mouth being separate than the body. The mouth and the body are the same. When you have a healthy mouth, you have a healthy body. When kids have good access to oral health care, they don't miss as much school, they're not in pain and discomfort, and they eat and take in better nutrition. So we know that it has an impact on their overall quality of life and their overall health care.
So this goes along with our mission to provide quality, compassionate health care. Oral care is so important to the overall health, and we're getting upstream on this. I know that in our adult dental clinic, we see a lot of things that maybe prevention. If we'd had prevention, early on in those early years, that we wouldn't be at a point as needing dentures. Unfortunately, we've had to have the remote area medical. We had 20 plus successful years where we pulled over 100,000.
Okay, I'll take your notes.
We had over 100,000 patients that had came through. Most of those, our number one service always was dental care. Unfortunately, we've had to pull a lot of teeth.
So unfortunately, in underserved communities, there are lots of issues that kids face. First of all, a provider may be hours and hours away. You may have a family with limited resources, so transportation can be an issue. You may have payment issues, and also just finding providers. It seems that most providers want to stay in more urban areas, and so to have a provider that moves or goes to rural Virginia or any rural community is almost an anomaly at this point in time.
But there was a little 7-year-old child that was, there in the dental chair, and our volunteer, he had went over to get an order or something like that, Jess Powers, and he overheard this conversation between him and the dentist. the little 7-year-old boy, he looks up at the dentist and he says, with fear in his eyes, with great fear in his eyes, and I'll get emotional, but he says, if I start to cry, he said, please don't stop. He said, I'm in so much pain. And even to this day, it makes me emotional because I know, how do we expect children to learn and to thrive if they're in pain? And dental pain is one of the most worst pains that you can have.
I grew up in an area with unmet dental and oral health needs. My classmate, Charles, nearly failed the 5th grade because he just simply couldn't access dental care. So most of my life has been spent looking at ways we can improve outcomes for kids. Because in the end, we know if kids have better childhood, they go into adulthood more prepared. That motivates me every day. I come from a family in rural southeastern Kentucky where we didn't have a lot, but we also believed in giving what we did have. And that sometimes meant of our time and our energy. And that's what I've always tried to do.
I really feel that God is calling us to do more with the pediatric. If God is calling us to do this mission, then He will provide the resources for us. So I'm just really hoping that this falls, this interview even falls on somebody's ear that, that can come alongside us. They can help, they can reach out, whether it be, volunteer, whether it be a monetary donation, so that we can do more.
The number of times that caregivers pulled me aside and hugged me and said, thank you for trying to make a difference, that has always motivated me to do good for others, to lean into what we're all supposed to do, which is help one another. I think that an event like this is a perfect example of that. We're leaning in, trying to help others so that we help communities. When I know that we've helped even one kid, I know we've made a big difference. So it's almost like just throwing a rock or a stone in a pond. You help one, and then the ripple effect hopefully makes a difference in other people's lives. That is important to me. Even if just helping one child, we help a community. When we help a community, we help lots of people.